So the lymphatic system is probably the most forgotten system there is, or never learned to begin with. I can tell you with my med classes I had, they never once mentioned the lymphatic system. And really in the medical world, there's very, very little they do with the lymphatic system. They treat it if it's infected, and they try to squish the fluid out of it, and that's the only two things they do. So they don't ever talk about prevention. They don't talk about how you would heal it, what you would do with it, or even what it does in your body. So that's kind of, we're going to give an oversight. When you leave here tonight, I don't think you're going to be quite as good as a lymphedema therapist, but you're going to probably know just as much as a doctor knows, or much more. So with the lymphatic system is a vast network of vessels to begin with. So it's throughout your whole body. And then you have lymph nodes. The lymph nodes are only in certain places of your body, and we'll go over each one of these individually. And then in the lymphatic system, there's a number of organs that also go with it. Your spleen is actually probably the largest lymphatic organ in your body, and we'll go more into balance or into each one of those. Its main job is to actually do fluid balance. Its second job is immune defense, and then it comes to detoxification. If we were a primitive man, it didn't have to do much detoxification. Nowadays, you can almost flip that balance. It's doing more detoxification and less fluid balance, and that's why we're swollen all the time. So it's really important to have the lymphatic system, because it is the balance between your circulatory system and your immune system. And we'll go into each step of that. But this is just an overview of what it does. The lymphatic system is extremely important in the fluid balance. So every day, as your heart beats, the blood goes out in your arteries. And arteries are rather large, and your vessels are small. The reason that works is as the blood goes out, some of the fluid seeps out to nourish the cells. All of your nutrients come out of the blood, some of the white blood cells come out, and your fats come out. They go to the cells, they're able to perform their function, but then that fluid is left there. And some of that fluid goes back into your bloodstream, but a big chunk of it is considered interstitial fluid. So we talk about interstellar, that means between stars. Interstitial means between cells. So this fluid is the fluid that's left between your cells, and it has to get back into the circulatory system somehow. So as the heart beats, blood goes away from the heart, fluid comes out, it bathes the cells, it gives the nutrients to the cells, and then some of it goes back in, it comes up through your veins and circulates that way. Well, all that fluid out there has to have a way back up, and that's where the lymphatic system comes into play. It also filters out pathogens. So when we talk about pathogens, we're talking about viruses, we're talking about bacteria, we're talking about fungus, we're talking about parasites. So it kind of cleans them out. So if you step on something, it's in your foot, you don't go get it pulled out, it has to go through the lymphatic system to do that. Toxins. So a lot of these critters I just talked about produce toxins. The lymphatic system pulls those toxins into the lymphatic system so it can filter it. But nowadays, we're looking at toxins like herbicides, pesticides, food dyes, ingredients that we shouldn't be getting in our bodies, chemicals we shouldn't be getting there. It has to filter those out. Another role it plays is the transportation of white blood cells. So white blood cells are our soldiers in our defense against things. So it's the transport of our white blood cells, which are our immune cells. These are our soldiers in the fight against the bad guys. So we'll go into more of how they play a role in this too. And then another big role in the lymphatic system is transportation of fats. So when we transport fats, we have to not only transport fats and fat-soluble vitamins out of the gut to our cells, we also have to take and transport. So fats, this is important to know, especially if you're trying to lose fat. The lymphatic system, all of your fat that leaves the digestive tract has to go into the lymphatic system, be pumped back up through to the heart, and all the fat that you try to get out of your adipose cells or your fat cells have to go into the lymphatic system, go to the heart, and then come back. So if you're having a problem with the lymphatic system, you're going to have a problem losing weight. I mean, it's just there. You can't get the fat out of the fat cell to the bloodstream if the lymphatic system's not working right. So it's an important job. From a historical perspective, Hippocrates discovered it in 400 BC, so 400 years before Christ. He basically found it. He called it white blood, is what he called it. And most likely when he called it white blood, he cut open somebody that had been eating a lot of fat. So when you dissect a human and an animal too. If they've been eating a lot of fat, it's real milky looking. If you cut open somebody who's not been eating fat, who's been starving to death, it's fluid. It's just clear fluid is what it looks like. It was mapped out in the 17th century, so somebody actually tweezed it out. When you open up a body, it looks very much like somebody has taken a sponge and basically ripped the sponge until it was a long piece like that. So you can kind of imagine these lymph vessels as being long sponges, and that's kind of how they work too. Every time your heart beats, it basically is sucking on the end of the sponge. And it just barely moves it up, moves it up, moves it up. If that lymphatic fluid starts to become thick, you can see as your heart beats, it's harder to move it up. You can see as you get older, if your heart's not beating as hard or you're not doing anything to stimulate the heart, it doesn't pull it up as easy either. So there's a lot of things that make a big difference in it. But basically, they knew a long time ago that there was something here and that it was important. Also on that same set, now, probably in the last 5 years, they're starting to realize that it may be the most important organ system in your body for detoxifying what's going on. So again, the lymphatic components, we have vessels, we have nodes, and I always think the vessels are kind of like your sewer pipes in your house. The nodes are more like your septic tank. So anybody that lives in the rural area, you have your septic tank holds your solids, and then it goes out to your lateral fields. That's the way it works. Then you have organ tissues, the thymus, the spleen, tonsils, Peyer's patch. I'll go through each one of these. Bone marrow, mucosal associated lymphoid tissues. I'll go quite a bit into these. There are different systems in your body that help your immune system work correctly. And then you have the lymphatic structures. This is the place where your brain and your central nervous system meets basically your lymphatic system. These lymph vessels now, they are important because they are the sewer system. They move stuff around. They have little valves in them, which becomes quite significant really. Anything in a lower half of your body, your vessels and the lymphatic vessels have to have valves, because every time they get sucked on, like that little sponge pulling up or your heart beats, the fluid would go up and it'd drop right back to your feet. When these little valves start having a problem in your veins or in your lymphatic system, you start having swelling. And so it's very important. While I'm on this, I don't have it anywhere else in here. When people go and get lymphatic massage, sometimes people say, oh, do it harder is better. Just squish the fluid out of you. You remember, these are like sponges. These little vessels like sponges. You come in and you start raking it out really hard, you start to break those valves. So maybe you go and get lymphatic massage all the time, and you're like, why am I actually swelling more than what I was? And it's because people who don't know how to do this are actually hurting you. So that's an important thing to know about those valves. They have capillaries. Just like in your bloodstream, we have capillaries. That's the end of the blood vessels where it goes from your arteries to your vessels. And then we have collectors. These are areas where kind of it's the difference between, it's like the end of the sponge. So it's all spread out. So if you took a sponge and I made it a long snake-like sponge, and all of a sudden I get to the end, I'm going to fray it out so it can collect more moisture. And that's how that collectors are. Then we have trucks and we have ducts. So this basically goes from smaller to bigger as we go.
Do the valves repair themselves?
Not always. Sometimes they do. It's kind of like anything on your body. If you go and cut your arm, if it can go back together, it will repair itself. You know, you may have a little scar there. It may not be perfect, but repair itself. Once you take that arm and you cut it deep enough and the tissue can't touch each other, it doesn't repair. That's the same thing with these valves. Same thing with lymphatic tissue. So lymphatic tissue, up to a point when it's touching itself, can repair. A lot of doctors come in and they just cut and they cut and they cut. And when they put tissue back together, a lot of times they'll put muscle tissue back together, or they'll put the skin back together, but they don't pay enough attention to putting lymphatics close enough back together. Because if they touch, they'll heal. And so probably from a surgical standpoint, like I said, medical doctors don't learn a lot about lymphatic tissue, so they don't actually work to even try to get it to touch. So it's significant in surgeries. It's also significant post-rehab. You know, if you go to a good rehab specialist, they're working not only on getting the muscle rehab, but they're working on getting the tissues back together so it looks better and works better. The fluid. Like I said, the fluid is the fluid that has come out of your bloodstream. And so usually it is a pale yellowy color, and all the way to clear is the way it'll look. It's the interstitial fluid is another name to say it. It carries proteins, it carries immune cells, it carries waste, it carries fat. On the average day for the average person, it's usually about 3 liters a day that's being recirculated back into your system. And so it's between 2 and 4. There's usually about 20 liters that go out of your system. So you can tell that a lot more goes back into your bloodstream, but this is a significant amount. If you take every day, if your lymphatic system is broken or clogged up, every day you're putting 3 liters out that you can't recover, you have a problem. So it's very significant in that. Lymph nodes. Lymph nodes are, like I said, kind of like this septic tank. And so everything goes in the lymphatic system. It's coming up through it. It has to be kind of checked and cleaned along the way. It gets into lymph nodes. Most of your lymph nodes are actually around what they call the mesentery. It's around your gut area. And so that's very important to know, because your lymph nodes actually do a big deal in teaching your immune system what is good and what's bad. So when you have about 60% of your lymph system is around your guts, it's a big deal. We have lymph nodes in our armpits, down by our breast. We have them in our neck. We have them in our groin, and then around our digestive tract. That's where the vast majority of these lymph nodes are. And we'll go more into what they do as we go through this. Your thymus. Your thymus is a lymphatic tissue that sets in behind your sternum. And it is there when you're born. Its job is to teach T cells, which are a type of lymphocyte, which are a type of white blood cell, what's good and bad. And so some kids are born without a thymus, and they have all kinds of immune system problems. Either they can't make an immune system, or they end up having an immune system that doesn't function properly. So the thymus is extremely important when you're a child. As you get older, your immune system switches over. It says, okay, I've learned all I can learn from you. So it's kind of like your kindergarten teacher or your first grade teacher. It's teaching your immune system what to do, but over time, it begins to just disappear. Once in a blue moon, when you're dissecting humans, you'll see that they have a thymus in there. It's not, I've only seen one person with that ever in my life. So it does stay on in some people. The spleen. The spleen is on your left side, right below your ribs. Some people have it backwards on the other side, but most people have it right here. Your spleen is a big spongy lymph tissue. So instead of being stretched out, it's one big sponge here. Your blood circulates through your spleen, and your spleen cleans out old cells, cleans out debris. It also houses a whole bunch of immune cells. So if you're healthy and everything's fine and you're not having an infection, the spleen sits there and holds all your white blood cells in there, and they're kind of just hanging out having a party. When you get sick, your spleen can swell up because it starts producing more white blood cells. It's pulling in all the bad debris, and you'll see people get swollen up. Mono is a classic case of that. You'll see people swell up spleen-wise, maybe even be swollen down below the rib cage. You also see a little bit of that happen with the liver with mono too. But it is a filter system. That's its job. So it's kind of like, let's say you have the sewer lines coming out of your house. That's the capillaries in that. It goes into your lymph nodes, which would be a septic tank at your house, and then it goes back out in the next drainage. It goes down the way, and they have maybe a big sewer treatment plant. Your spleen is your big sewer treatment plant, is what it is. Now, MALT. So MALT means mucosa-associated lymphoid tissue. That's the abbreviation for it. This is a group of lymphatic tissues that have different roles, and I'll go into each one in a little bit. But your respiratory tract has this system, your digestive tract has it, your nasal passage, your urogenital, your reproductive organs. They are everywhere in your body that is protecting you from the outside. So all the passages into your body have this system. And so the reason it's mucosa is the lining on the inside, like when you go in your nose, you go in your ears, you go into the urethra, the vagina, things like that. Those are mucosa. So that's what this pertains to. There's actually probably twice as many systems that protect you, but GALT is the gut-associated lymphoid tissue. And in the gut, if you think about it this way, your gut is exposed to the outside environment. It's just a tube. So anything you put in goes through you, anything that comes into you goes through you. It has to be able to protect you every day, just like your skin does. So we'll go individually into that one. The bronchius-associated lymphoid tissues, when you inhale things, you're exposed to it. Whether it's bacteria, whether it's viruses, whether it's toxins, you need to have a lymphoid tissue there to protect you again. NALT, nasal tissue protection. URALT, which is your urogenital. So Basically, your urethra, anything that every time you pee, you need to be protected. Calt, which is conjunctival, this protects your eye. So it's the tissue right around your eye. So sometimes you get styes, you get things like that, you get swelling around your eye. That's this system trying to protect you. Lalt is the larynx. I've had some interesting cases that have been missed by a number of ENTs, by doctors. People have been to see 5-10 doctors, and they have a yeast infection in their Lalt system. So they get back down here in their throat by their larynx, and they get to where they can't swallow very good. Their voice is going away. They go and they have it all checked out. They keep seeing doctor after doctor, and they keep telling them they're fine. And usually we treat them for a fungal infection, and all of a sudden they start to heal up and it goes away. So I've seen at least probably a dozen patients in my life that was a thing. And so that's an important system. It protects you, but when it goes wrong, you have a hard time swallowing. You have a hard time even talking. Salt. This is your skin. Your skin has a ton of glands, a ton of tissue underneath of it, lymphatic system. This system is the one that we see that gets messed up all the time with diabetes, with individuals that have swelling in their legs. The system backs up, it can't clean out debris, and then you get infections in your lower limbs. You lose your toes, legs, things like that. So this is a very important one for protecting you. The vault, this is for vaginal tissues, and the taut is for testicular lymphatics. So both of them are very important in reproduction. By the way, in men, women can have a problem when they have an ovary removed, that kind of stuff with that vault. And then guys, whenever they get snipped, they have a problem with it too. So you'll have individuals that get enlarged testicles and things after a vasectomy. So that's important. Galt. Probably the most important one right now in our lives is galt. Galt is the most exposed as stuff goes through us. We have more toxins, we have more preservatives, we have more stuff going into our gut than ever before. And so it is associated with the Peyer's patch, which are patches inside your small intestine that tell us who the good guy is and who the bad guy is. And it's basically talking with your lymphatic system and says, okay, I just saw this bacteria. Is it good? Is it bad? Okay, I have this reaction to this food. Is it a good reaction, a bad reaction? So it's kind of I call it the central processor of your gut lymphatic interface, is what you would say. We have our appendix in there, which is actually, its job is to grow bacteria in it and tell your body what is a normal bacteria in your gut. So people that have their appendix removed, a lot of times will have dysbiosis, they'll have gut issues, because now you've just shut off the ability for the lymphatic system to know, was it a good guy or bad guy? And then we have isolated lymphoid follicles in the intestine. So these are again our areas that kind of pull in tissue, analyze it, and say, okay, yep, we're doing our job. Nope, we need to clean this up. What's going on with the immune system? So there are a lot of checkpoints in the gut. The problem is these checkpoints are made for primitive man. And when you start throwing in modern day stuff into it, it gets really confused. You take, if anybody's been here to listen to the gut one and several of the others, you take gluten. Gluten before 1978 had 5% lectin in it. It's part that you can't digest. Nowadays we have 65% lectin. So when you eat white bread or eat gluten, we eat 65% of it we can no longer digest. So it gets in these areas and the body says, what do we do with this? And it says, well, we can't digest it, so let's just make an immune response to it. So probably in the next, yes ma'am?
Is that difference in have to do with the processing of the wheat or the wheat itself?
The wheat itself, Monsanto is one of the major contributors to that. They modified the wheat so that it would last longer in grain bins, and so animals wouldn't eat it. When we were kids, we used to have weevils in the wheat, and now you can leave your flour out on the counter, and it would be very, very rare that you would ever get a weevil in it, because they can no longer, once it gets above, like I think it's 35%, they can no longer eat it. And we can't digest it either. So, and they know it, we still try to eat it. So it's kind of interesting. But that's one of the reasons, probably in the next 10 years, probably 90+% of people in the United States will have a gluten problem, because it gets in these areas, your body can't digest it, that lymphatic system gets confused and makes an antibody to it. It monitors again the bacteria, what's good, what's bad. It basically says This is a good bacteria, bad bacteria, and then it also modulates how we respond to food. Again, the wheat. Is it a good thing? Is it a bad thing? And in the past, it was a good thing. Now it's confused. It plays a role in educating your immune system. Again, so not only just the food you eat, the bacteria, viruses, yeast, but also preservatives. It's not understanding what we're putting in our bodies. It says, I know what an apple is, I know what a peach is, but I don't know what this herbicide is or this pesticide or this dye is. And so once it starts reacting to things, it thinks you're under attack. And so it starts reacting to many, many things. It becomes polyreactive. So the other issue with this lymphatic system in here are called lacteals. Lacteals are specialized lymphatic capillaries. So they're the end, where I said the end of it's kind of frayed out. These ones, lacteals, their job is to collect fat out of the digestive tract. So they basically come up and say, oh, here's a vitamin D, let's pull it in. Here's an omega, let's pull it in. A, E, it pulls them in and allows you to digest them and allows you to use them. This is probably a good place to say this. There are a number of individuals around that people would look at them and say, wow, that person is a large person. They need to stop eating. You know, they're fat. The truth is, a lot of those individuals have a lymphatic issue. And if you sit down and talk to them as a doctor, many of them are eating less than 500 calories a day. They're actually starving to death, and they're heavy, and they're having a lymphatic issue. And it's because they actually can't even digest the fat they're putting in, but they can't pull the fat out of their system, put it in, and then they just swell up with fluid. And so anytime you see a really morbidly obese person, you think, well, somebody should stop buying them food. A lot of times it's actually this issue. And you can tell it as a doctor when you feel these individuals. If you feel a person who's fat, a lot of times I'd say take a balloon, fill it with cottage cheese. You can feel the chunks in it. You can feel what it is. That's typically how fat feels. And everybody has a little fat. I mean, if you feel it, you can feel it in your body. But then you feel a person has this lymphatic issues. They feel like fill a balloon full of pudding. You feel it. There's not fat in there. And so a lot of times, even as a patient, you'll see me feel the back of your arms. You see me feel your ankles and stuff. I'm looking to see, okay, what kind of fluid is here? Is it lymphatic fluid? Is it fat? What's going on? So that's important to know that these lymphatics move around fat. They not only take it into your body, but they get it out of your body. They make you be able to use it. And then basically gut inflammation can overburden the lymphatic pathways. So many of you probably have food sensitivities now. It's part of American life. But you will eat something and you'll say, yeah, I ate something wrong because I only ate a little bit and I swelled up overnight. I'm like pregnant the next day. That's because you overwhelmed the lymphatic system. It was thought you ate the bad guy and it's trying to kill it. And so you swell up great big. So those are things to know about the lymphatic system. It helps with immune system, and I'm going to say maturation. And I'll come to that in a little bit. It helps it learn what's right and what's wrong. But the important thing is to know what's harmless foods and what it really has to react to. What's a poison, what's things that are bad. And this used to be really easy when we were cavemen. You eat one weed and it's noxious to you. You get rid of it, you throw it up, lymphatic system clean up. Now we just don't know anymore. Our bodies are confused. This is what leads us to food sensitivities and inflammation. So BALT. This has to do with the lymphatics in your lungs is what it has to do with. This is where we see a problem with individuals who have either had infections in the lungs, but also we see individuals that especially have respiratory allergies, or the big one that we see in little kids is dairy. Dairy, when you have a dairy sensitivity as a little kid, you have asthma. So almost every little kid that comes in that has asthma, I test them to see if they have a casein sensitivity. Casein is part of dairy, and I think I'm going to say 100%. I've never had a little kid that came in with asthma that didn't have a lymphatic problem in their lungs due to casein. And we take dairy out, and their world changes overnight. So we have kids that are on inhalers, they're on steroids, they're on everything else. We test it, we take it out, and I have parents that come in and say, I can't afford the test. I say, it's real easy. Go take dairy out. And it changes their world. You know, I don't think I've had a kid yet. We've had kids that have had some other issues, but we take out the dairy and it lowers that problem significantly.
Does like yogurt or fermented things
still has it has casein in it. Except like cheese is the worst. So dairy has 4 things in it. It has lactose, which about about only 1/5 of people after about 6 or 8 years old can actually break down lactose. Then we have casein, which is the thickening agent. So when they talk about curds and whey, casein is curds. Then we have whey, which is the fluid, and then we have ghee, which is the fat. Most people don't actually react to the fat, which is interesting enough. The proteins are not there as much as they are in other stuff. But casein is usually the problem, and so the thicker it is, the more problem you're going to have. And kids love cheese. They love mac and cheese. And so, in fact, yes, ma'am.
And I can eat like cheese,
Yeah.
but I can eat cheese that's over 5 years age.
Yeah, and it could be because the protein in it is actually breaking down. So the casein protein is actually specifically a protein. So you have a sugar, which is lactose, a protein, which is whey, a protein that's casein, and that fat that's ghee. So a lot of times, if it's fermented for an extended period of time, it breaks it down. Fermented in the United States, we don't have cheeses that are usually fermented that long. It's usually European cheeses or maybe even foreign country cheeses. That would help out with that. But that makes a difference. And then this is where we get our respiratory allergies at. People that are having seasonal allergies, it's because you inhaled things and your body thinks it's a foreign invader, which it is, but it thinks it's a big deal. And so you start having respiratory issues because the vault is overreacting to it. It's not educating properly. Fluid has a lot to do with this, and I'll talk about hydration later, but people that are dehydrated tend to have more problems here than people that are hydrated. And most people in Wyoming are dehydrated. It's just easy to do, myself included. NALT, this is the nasal passage. This has to do with all the tissues up in the sinuses with the nasal passage. And again, these are your nasal allergies. When the body sees things it doesn't like, right now, about a week ago, ragweed started blooming. Your dwarf ragweeds and those, it'll get worse as September comes on. But there's a lot of people that are walking around, they're like, my face hurts a little bit when I touch it. I'm tired. I don't know why I'm so tired. It's because these are invading your nasal passages and you're reacting to them. Uroalt. So uroalt is basically the urogenital area. So this is, again, your urethra. We have issues here, whether it be from intercourse or we tend to get some issues where we get older and we start to have a little leak and it's fluid and bacteria like to climb up inside you. This basically is reading those bacteria, reading those fluids and things, and it reacts to them. Some individuals will even have chemicals that they're taking in. They'll have dyes. So you'll have, it tends to have more in women than men, but you'll have dyes. Maybe you're taking a red dye and it gets down in the bottom of the bladder and it irritates the bladder. The bladder says, oh, this is an enemy. Let's start fighting it. And basically you become sensitive and you have all these bladder problems. You're going in, they're giving you antibiotics every month. They keep testing you, have problems. And a lot of times it is a food sensitivity, a dye, or some ingredient that you're actually overreacting to. And so if you're getting tested and you're not having a bacterial infection, but you're still having sensitivities, most likely it's this system overreaction to some chemical that you basically take in, and it's water soluble, so you're peeing it out. Wall-Dyer's ring. Wall-Dyer's ring is basically, when you look in the back of the throat, that's your tonsils, and you can kind of actually see the tissue of a ring behind the back of the throat. That's what this is. It includes all your tonsils, your adenoids in that area, and it's as you swallow or as you're breathing, bacteria, viruses, somebody coughs in the room, it hits that, it pulls it in, it starts trying to process, is this good or bad? And that's why we have our tonsils there. Their tonsils are to educate the rest of your body on what's good or bad when you're breathing or when you're eating. And so sometimes when we take out the tonsils, sometimes tonsils have to be taken out. I'd say it's rare that I ever send anybody for surgery, say you need a surgery. But if I do, you can pretty well bank on it that you need it. And once in a while, the tonsils are a situation where I've had young guys, I don't think I've had too many girls with tonsil problems, but young guys come in and the tonsils are about that big and you look and there's no space between them. And you have them swallow something and you can see it squeeze all the way just to let it through. And so there's been a couple guys that have said, yeah, you need your tonsils out. You hate to take them out because they educate your immune system, but sometimes it's necessary. The lymphatic system. The lymphatic system is basically the tie from your brain, your spinal cord, and the fluid around it to your lymphatic system. So it's basically what keeps the debris from your brain, the debris from your spinal cord. It takes it out of the cerebral spinal fluid, takes it back to the heart, takes it to your spleen to clean it up. When this is not working right, you get things like Alzheimer's, you get Parkinson's, you get major issues with this with multiple concussions. Basically, you have your brain, you have cerebral spinal fluid around it, You have meninges, which are kind of like a little skin lining that goes around that fluid. And then you have this lymphatic system, which kind of cleans it all out. When you get concussions, you're breaking that lymphatic fluid, or you're breaking that lymphatic system around, so you don't clean out your brain as well. You don't clean out your spinal cord as well, and you will have problems when you get older. So we're looking at more of a problem here. The reason this is a bigger deal now than it was when we were kids, we're putting a lot more toxins into us. The lymphatic system's having a hard time dealing with things, and it kind of sees this as its secondary job of cleaning up the lymphatic system, because usually you don't have any toxins in there. But all of a sudden, you have a lot of toxins going into your gut, so it's working harder on the GALT system. It says, hey, this is a cleaner area in your body. The GALT system is really bad. Let's just let this go. Well, now you get a little age on you. This system hasn't been cleaned properly. So it's, again, if you go back and think about a sewer system, this one here is the upstairs bathroom that people don't visit. You know, maybe the guests come in and visit once in a while. And so you're downstairs, you've gotten older, the stairs get harder to get up. You're saying, hey, I'm going to scrub this toilet down here. It seems to get dirtier more because this is the one by my bedroom. And you forget to go clean the other one. Well, over time, the toilet gets yucky, the plunger doesn't work on it right, things like that happen. That's what happens in our brain and why we're seeing more Alzheimer's, we're seeing more dementia problems. We're probably seeing more issues in kids with emotional issues and things because this system is overwhelmed too. The brain, gut-brain connection, or the lymphatic brain connection. So again, concussions are an issue, but sleep is extremely, extremely important for this system. When we're doing stuff throughout the day, it's worried about the rest of our lymphatic system. The only time this system really recharges and cleans out is when you're sleeping. So a lot of people having sleep issues, a lot of people doing all kinds of things at night with sound systems, things like not letting your brain rest properly. This can't work. So sleep is extremely important in the lymphatic system and able to allow it to clean out properly. Dysfunction in this, again, it leads to Alzheimer's and it leads to Parkinson's. It leads to emotional issues, anxiety, depression, that kind of stuff. Fluid balance and edema prevention. So your capillaries, these are the end of your arteries where your arteries turn into vessels and come back up to the heart. They leak 20 liters of fluid a day, and approximately 16 to 18 liters are reabsorbed back into the bloodstream. Now, the interesting thing is, most that's leaked back into the bloodstream doesn't carry in proteins, doesn't carry in fats, doesn't carry in white blood cells. It has to be really fluidy to come back into the bloodstream. And so that 16 to 18 liters that come back in is strictly fluid. That 3 liters is lymphatic fluid. It usually is gunked up sewage. So again, if we think about the septic tank, a lot of times there'll be a pipe on the top that takes the clean fluid off and the stuff settles at the bottom. The stuff settling at the bottom has to go through your lymphatic system is the way it works out. Blockages in this system lead to edema. And I'll get more into the causes of that in a little bit. Again, the absorption of fats. If your lymphatic system is not working right, you do not absorb fats, and also you can't pull fats out of the fat cells and put them back into circulation to use them up. So you can have individuals that are eating 500 calories a day, they're not absorbing the fat, and also they're not pulling the fat out. So they just kind of fill up a little fluid and they stay having their fat where they are, and they're actually starving to death. So it's kind of an interesting thing. The fluid, the more fat you eat, and if the fat is actually getting in the lymphatic system, you see it as being white. So when I talked about Hippocrates earlier, when he called it white blood, he was looking at somebody that had probably eaten a lot of fat when he did it. And then basically, those lacteals go to the lymphatic system, which then comes back to the bloodstream. That's how we get fat out of our digestive tract into our bloodstream to be used for our cells. Waste removal and detoxification. Lymphatics remove waste and proteins and clean tissues. The bloodstream doesn't do that. So again, you're at the cells, let's say our feet, because it's easier to start farther away. The blood comes down, it gives nourishment to the cells around it, the fluid comes out, the cells use it, the cells basically send out their waste. It's all just kind of a little cesspool there. Some of the fluid goes back into your capillaries, goes back into your bloodstream, but then all of the sewage is left there. These basically lymphatic vessels look like sponges. As your heart beats, it sucks on the end of the sponge up here by you, and it pulls a little bit of lymphatic fluid up. Well, when your heart is not beating, it wants to fall back down. Those lymph vessels have valves in them that hold it there. So every time your heart beats, the fluid comes up a little bit, comes up a little bit, comes up a little bit. And it gets your lymph nodes, it's cleaned out, it comes up a little bit, comes up a little bit. At the point that you get too much waste or the waste gets too thick, as it sucks, it can't pull it up. So it's like a big, thick milkshake. You can't pull it up through there. And that's when we start having problems with removing waste out of there. I will cover that a little more too. The next big catch on this is immune surveillance. So I mentioned that your lymphatic system is pulling in junk. Well, your immune system is looking at all of it. So again, if we take it from a waste standpoint, you have the recycling center. The recycling center, you pour out all the waste there and they're saying, okay, that's metal, paper, plastic. Your immune system is surveilling this lymphatic system and trying to decide what's good, what's bad, what do we need to throw away. So somebody just threw their eggs in with the cardboard and everything else, they're trying to throw that out of there. It does that. We have in this system, our nodes are kind of the filter where it all gets in there. And that's where most of our white blood cells do their work with recognizing things. So it's very important to have good lymph nodes and working properly and have the lymphatic system be as thin as possible so stuff can get in and stuff can get out. If anybody's ever had a filter and maybe they're filtering something out, once it gets so clogged up, it's not worth anything anymore. So I always think about a paint filter. When you're trying to thin paint out, you run it through a paper filter. And when you put it in, it works really good. The clean paint's coming out. After a while, you can pour in all you want to, and it won't come out. The lymphatic system and the lymph nodes work that same way. So there are four main players in white blood cells in the lymphatic system that make all the difference to how it works and how it recognizes things. B cells. B cells are, they produce antibodies. So many of you have heard of antibodies. There's really four main types of antibodies. There's the IgE, and that's when you have an allergic reaction. And so IgA send out histamine, makes it hard to breathe, you get hives. That is the mean one of antibodies. It basically says, this is something that's going to kill you. We need to produce so much fluid that we drowned it. And so it actually drowns you in the system when it's happening. IgGs fight off viruses, bacteria. That's our main job. And they come in and they make a fever in the area. They make it hot. They make fluid come to the area so that you can kill it off. And IgMs are usually produced from mucosal membrane. So they're also produced in the breast. They're produced anywhere that you would make mucus. And they are just a kind of a neutral line of defense fighting off different things. And then you have IgAs. IgAs are produced almost directly out of the lymphatic tissues. So they're the ones that come out of the back of the throat, out of the mucosal lining in your stomach, out of any tissue that's trying to protect you from the outside. T cells. Let me back up. B cells, they produce these antibodies. Antibodies are like flags to point out the bad guy. That's what they are. So, for instance, if you have E. coli bacteria, you've been exposed to it, this recognizes it. Maybe you ate something in Mexico. It pulls it in. It gets in the lymphatic system. The B cell says, you're a bad guy. It comes over, measures it out, figures out, okay, this is what identifies you. It makes a flag, and that flag is unique for that E. coli. It's a big green flag with an E on it, E. coli. So now, next time you eat E. coli, next time E. coli tries to climb up your urethra and give you a urinary tract infection, the B cell that's floating along, and it touches up against the flag that's on there, and it explodes more flags. So now it puts out flags, and now your body recognizes it as the enemy. And that's the job of the B cell. Marks the enemy. So the T cells, they have a lot of roles. Their main role is to kill the bad guy. So natural killers, they also regulate how we fight off stuff, but their job is to kill out bad guys. And so once the B cell makes an antibody, basically a T cell knows this is a bad guy. And anytime it sees that antibody, it kills it. And so that's what we have, adaptive immunity. So we figured out who the bad guys are. We're making basically the way to do it. Some people always refer to B cells as being the laser guided system. It shines the laser on it, tells the T cell, that's your guy you need to strike. Both these cells are born in the bone marrow, and they mature in the thymus. Once you lose your thymus, They mature in the lymphatic system. That's why as we get older, if we have a lymphatic issue, we tend to have an immune issue. Either our immune system overreacts and we have autoimmune diseases, or it underreacts and we get sick. So it's important to have a good immune system to control, or a good lymphatic system to control your immune system. The other two major players from white blood cell standpoint in your lymphatic system are macrophages. Macrophages are kind of like big blobs when you look at them under the microscope, and their job is to eat the bad guys. So maybe it got a flag put on it, antibody put on it. It comes along, sees it, and it just goes, engulfs it, is its job. And that happens a lot in your lymphatic system. It does a lot of that. When your lymphatic system gets swollen up, a lot of times it's because the macrophages are ingesting a lot of bad guys. And that's kind of the way down there. Macrophages don't just have to eat bacteria, viruses, they also eat bad chemicals too. And so that's an interesting thing about them. The dendritic cells. Dendritic cells kind of look like octopuses. And so they figure out a bad guy and they're going along and they're like, you look suspicious. So a lot of times they'll grab it, and sometimes they'll even take it over to the B cell and say, hey, check this out. Good guy or bad guy? Sometimes the B cell pulls it in and says, yeah, bad guy, good call. Sometimes it comes over and says, nah, it's all right. Let it go. After the dendritic cells have figured out a bad guy for sure, they sometimes grab the bad guy, take it over to the T cells and say, this is who you want to kill. This is who. So it's like going out in this field and bringing back in, hey, here's the uniform you're looking for. That's the dendritic cells. Dendritic cells tend to also play a big role around the cerebral spinal fluid, around the brain and that. So it's important to have them and to have them function correctly. Innate versus adaptive immunity. Probably my next talk is going to be on the immune system. So I'll go in depth into white blood cells, innate, and all that. But basically know that innate is fast acting. This is what you're born with. You're born with innate immunity who says, hey, this is a good guy, this is a bad guy. And it's pretty simple and it works pretty good when you're a little kid. As you get older, you get adaptive immunity. And that means we're educating our B cells and our T cells using our lymphatic system. So born with innate, you grow into adaptive. And the lymphatic system is important in making the adaptive system. The lymph nodes react to infections. So when you have an infection, let's just say a bacteria virus, it gets pulled into the lymphatic system, maybe again, let's say your foot, it gets pulled through, it makes it up to the lymph nodes in your growing area. When it gets there, that's where your white blood cells are hanging out saying, hey, looking for the bad guy. Whoa, we got action here. As soon as it sees the action, it puts the antibody on it. The T cell comes along, it kills it. When the T cell kills it, it puts out a bunch of chemicals, cytokines, interleukins, and those make more fluid come to the area. It also is like a calling card, like here's the enemy, bring all the white blood cells there. So all those white blood cells come in and they try to figure out what's going on with the enemy. They try to kill the enemy. They also try to sequester the enemy. They try to pin him in where he can't go anywhere. So it's kind of like surrounding the wagons on a round thing and trying to keep it there. When that happens, the lymph nodes swell. And that's a natural, normal response when you have an infection or something going on with the lymph node, is for it to swell. Now that lymph node, within a 2-week period, 4-week period, should be able to clean itself out and get rid of that debris. And that's called an acute response, acute inflammatory response. That's normal in our body. We should have inflammation. When you get hurt, when you get an infection, that inflammation says, we are coming in to clean up. We're going to bring in more fluid. We're going to bring in more proteins. We're going to bring everything to clean up house and take care of it. When you get out past 8 weeks and that lymph node's still swollen or that tissue's still swollen, still having problems, that's called chronic inflammation. That's called an aberrant inflammation, which means abnormal. And at that point, something's gone wrong. Either your immune system couldn't clean it up, you kept having the same infection over, you didn't get antibiotics, you didn't get treated for it, or something's going on that now it's done it. Once you get past that 8 weeks and you have a lymph node swollen, a lot of times they consider it a abnormal reactive lymph node, and they can get huge and they can get really sore. They can be sore and smaller when it's a normal reaction. Once you're out past that 8 weeks and they're still large, a lot of times that will actually calcify. Your body says, I don't know what to do with this reaction. We're just going to calcify that. And so you can have an infection when you're a young person and you say, yeah, that lymph node swelled up when I was 12 years old. It's been there forever. And that's not an uncommon thing for some people to have either one in their groin one in the neck or one in the armpit that's been there for a long time. We prefer not to get there, so you want to pay attention to lymph nodes when they swell. You want to say, what is the cause of this? And take care of that inflammation, why it's acute, and not let it get chronic.
Can those be removed?
Yeah, and that's a lot of times what happens. A lot of times they'll do an ultrasound on them. First of all, your doctor will usually palpate it. They'll touch it. And lymph nodes that are fixed, when they won't move. If I have a lymph node here on my side of my chest and I go to move it and it seems to be fixated, it's stuck there, it won't move, those are concerning. Those are ones that tend to have moved tissue outside the lymph node. Your body's trying to surround it, lock it down. So we're looking at either a chronic infection, we're looking at cancer when things are fixated. When we come in and we can take a lymph node and you say, hey, I have motion in here, those are usually less alarming to a physician. Those are ones that have become reactive, become chronically reactive. A lot of times they'll come in and they'll ultrasound it. And when they ultrasound it, they're trying to look at, is it consistent? Is it what they call homogeneous? Means is it the same throughout it? If they look at it and it's called homogeneous, means part of this is thick, part of this is thin. That's more concerning because it says something's still going on there. Once it's calcified, once it's become hard, they say, okay, it doesn't seem like there's any more activity there. When you see heterogeneous or it's different fluids in there, a lot of times they'll want to take it out, biopsy it, and see what's going on. So, but yeah, definitely take them out. We had one taken out. My son was 2 or 3 months old, got a horrible viral infection, and we almost lost him. And he ended up getting a swollen lymph node in his neck at 1 year old. And it was probably, we got out to, I'm going to make up the number, I don't know, 6 years old or so. And that lymph node was concerning to us still. I had an ENT that had measured it several times with ultrasound. And one day when we were seeing her, she goes, you know, if this is my son, I wouldn't wait any longer. I'd take it out to make sure it wasn't cancerous. We took it out. It was an old, benign, reactive lymph node. But it was one of those situations where time had passed enough, we should have took care of it. Interesting enough, if he catches a cold, the lymph fluid around that area builds up because remember, that lymph node is in that tract. If you take it out, you just broke that chain. So now it's not connected together. So that lymph fluid now will build up in that area, and with some massage or him moving around, he'll now find the other end and get out of there. But you can tell when he has a little cold because you'll see a little bit of swelling on his neck there.
Can you splice that together somehow?
It's like sponge, so it'd be hard. So if you go to put it together, when you try to stitch it together, it basically makes a scar and it closes off. Now, I will say that's probably a better option than leaving it apart because this is apart. If I try to splice it together, it's here. At least the fluid only has to go a centimeter instead of going an inch. So probably when I opened up and I said most surgeons are not paying attention to lymphatic tissue, I think it'll become a thing of the future where probably either they will start trying to bond that together and they'll probably come up with a glue. They'll come up with they pull out some of your lymphatic tissue, they culture it, and they put it back together that way. That's how it'll happen in the future. There'll be a fix for it. It's only now being paid attention to. The lymphatic system has been, the redheaded stepchild. It's not being paid attention to. Nobody cares about it. And so I think right now we're on the cusp of seeing mitochondrial health be an issue. I talked about that last month, and there's a video out for that you can go watch. But I think mitochondrial health and lymphatic tissues are probably the new frontier in medicine, and probably going to have to be because our immune systems now are not regulating properly. Everybody's getting autoimmune diseases, they're getting food sensitivities, they're getting everything, and it's because of the mitochondria and because the lymphatic system don't work together. Mitochondria. We had a whole talk, hour and a half last month. It's on video if you want to go see it. But mitochondria are the powerhouse in your cell, but it's more than that. They are inside your cell. They're the ones that clean out debris. So they basically package debris, hand it over to vesicles to get it out. They come in and they get rid of what's called ROS, reactive oxidative stress, our species. Those are chemicals that your body can't break down. It packages them. It neutralizes them. It also makes your energy. So when we start having a problem with mitochondria packaging up all this waste, it tends to just upchuck cell material out into this interstitial fluid, which then your lymphatic system starts backing up. It starts becoming a problem in your lymphatic system. When your lymphatic system starts having a problem, the mitochondria can't put the stuff out of the cell. So then your cells start having a mitochondrial problem. So it's kind of this catch-22 between mitochondria and the lymphatic system. It's a big deal. And this is probably, when you look now, they said out of the top 15 non-injury deaths. So if you take the top deaths in the world right now, and you take away the traumas and the injuries, 14 out of the top 15 are autoimmune related now. And when we talk about autoimmune disease, we're talking about a problem with the mitochondria in the lymphatic system. That's really what we're talking about. And people that want to put their autoimmune diseases in remission have to pay attention here. And I will say this from my own standpoint, my world as a doctor has probably been changed drastically by doing last month's talk and doing this month's talk. And so I think I said on the last month, I'm coming up with some new procedures. I'm coming up with new ways to not only test this, but also take care of these issues. And I think it's probably going to be what has to be done to solve the problems with some of the food sensitivities we're having, the autoimmune diseases we're having. And that's probably why I won't do a talk probably next 2 months, because I'm actually working on this. And it takes me 100 hours or more to put together these talks. And if I can take 200 hours, I can probably do a lot on that. So it'll be something coming up. And if we can do this, even in our area, we can make the community a lot healthier. So I'm working on it for myself and my kids and all of you. So mitochondria, I gave you enough on mitochondria. That's the lowdown on mitochondria. This again says that it gets rid of those oxidative stress, it detoxifies, but it's a cyclical thing. If lymphatics have a problem, mitochondria have a problem. If mitochondria have a problem, lymphatics have a problem. Common lymphatic disorders, lymphedema, lymphitis. It's basically that shouldn't have that D in there. That's spelled wrong. And then lymphoma and filarius. We'll go into each one of these. So lymphedema. I was fortunate enough. I was one of the few people when I went through school. Maybe it's different now. As I went through chiropractic college, I did an internship at the hospital. And at first, it was really nice. I was following around doctors. They would ask questions and they would say, Dr. Thoma, what do you think we should give this patient? What do you think we should do? That lasted for about a day or two. And all of a sudden, I think it was my second or third day following around the doctors, and they said, well, Dr. Thoma, what do you think you ought to do here? Why don't you go ahead and do this procedure or whatever? And I had to stop and say, hold on, I'm not an MD. I'm a DC. I'm a chiropractor. And the guy just about lost it. He's like, hold on, you've answered better than any of my other students. You're doing great. What are you doing here? And I said, well, actually, the hospital wanted to have a different perspective, so they invited me to be an intern because I have a medical background. He goes, yeah, you have a great medical background, but you're not an MD. The next day, they kicked me out of following the doctors around, and they put me in the lymphedema therapy clinic, which was probably one of the best experiences I ever had. People would come in, and they had breast cancer, they had lost their legs, they had had lymph nodes removed, and they would be swelling up. And the ladies that worked in that clinic, they would teach people how to do a massage correctly. They would teach it to fit them for compressions. They had an incredible knowledge, and they were incredible caring, and they were good to me. But I realized at that point, I didn't have enough education on lymphatics. And so I went down and started studying lymphatics myself. And I found out, yeah, it's the redheaded stepchild. Nobody knows about it. The doctors didn't know. When somebody would swell up and the doctor didn't know what to do anymore, they'd put them on blood pressure medication. They'd put them on diuretics. Well, they were pulling the fluid out of the bloodstream. They were never getting the fluid to move in the lymphatics. And so these ladies taught me a lot. So that was my experience in the hospital. It was a good experience. They sent me to some other places. They sent me to the hormone clinic. I learned a lot about thyroid, a lot about hormones. So in the end, it was a blessing for my career. Lymphedema. Lymphedema happens when the system either has a break in it. So we talked about the lymph node being removed. So now the fluid can't get from here to here. Or the system is so full of debris that the debris can't get through the system. It can't suck up. So it's a thick milkshake again. It can't go through there. Or we're getting fibrosis. We start getting the tissue starts getting scars in it. And I talked a while ago about going and getting a really deep lymphatic massage and just push it out of me, push it out of me. When you start breaking up this material, it gets scars around it. And now it may work really good for a couple times. You try to get the fluid moved out of you, you start to get fibrosis in there. And then also infections. Some people will get infections. They'll come in to see me, and let's say they have foot and fungal infections on their feet. Maybe they have a little red sore here and like, oh, it's no big deal. It's been there forever. That infection is being cleaned up by that lymphatic system. all the time. Well, it starts to get into that lymphatic system. It starts to infect the lymphatic system. And some people, probably especially fungal infections that move real slow, they think it's no big deal. I've always had that foot fungus. Dad had it. He was in the military. We got it from him. It's no big deal. It's a big deal. Your dad lost his toes when he was 70, 80 years old. He lost his leg when he was a little older than that. And you're heading the same thing because you're not paying attention to your lymphatic system. So all of those things cause it to be thick. Surgeries and traumas are the big ones. You get somebody who gets cut on the side of the leg and they bandage up, especially a guy, bandages up, goes on his way. Well, he just cut in there deep enough to not cut arteries and veins, but to cut that lymphatic system. Now, 5 years later, he's like, I don't know why that foot is swollen. I have to wear a different size boot on this foot than I do the other. It's because he's injured it. Athletes, when they're playing football and stuff, you see all the professional athletes when they get older, they're all swollen up and walking around great big. Most of them have had fibrosis. They've been beat the heck out of them and they have problems. So it's a significant thing there. This is probably our number one issue. It can happen because of trauma. It can happen because of infection. It can happen because the fluid gets thick. It can happen because of dehydration. That fluid has to stay thin. If you're not drinking enough water, you're not getting enough fluid in your body, it gets thick. Lymphangitis, this is basically when you get an infection in that lymph tissue. The most common two are strep and staph. And everybody knows the staph infections happen, but strep happens too. This is normally, you'll see people come in and they'll get a red streak kind of going up their leg, and it'll be a certain pattern. It kind of look like an upside down Christmas tree coming up there. This is lymphangitis, and usually it requires an antibiotic to treat it. People come in, and there's individuals that I will see. I will be checking them out, and all of a sudden I'll say, hey, that leg, is that hurting? Oh, not too bad. And you poke out like, yeah, a little bit. You feel it, and it's hot. And I send them, I say, you need to go get some antibiotics. Oh, no, I don't think so. Yeah, if I say you need a medication, it's not my normal routine. You need it. It's kind of like surgery. You'd need it. So that one can be deadly. Most bacteria replicate every 2 to 6 hours, so 4 hours on the average, and they grow exponentially. So if that's enough where you can see red in there, you could be 12 hours from being dead. So if you start having that. Yeah, exactly. Yeah, because once it becomes, so this is when it's in the lymphatic system. Once enough of that fluid gets pumped up to the heart and gets into the bloodstream, you're septic. And usually we're looking at, after it's gotten the red streaks in there, you're looking at 4 to 24 hours before you're septic. Yeah, and so it's fast. And so some people think, well, I had that up to my knee. It's been going slow all day. It's up to my knee. I'll get it checked out tomorrow morning. And by tomorrow morning, they can't hardly move. They're calling the ambulance, and hopefully they save their life. Filarius, this is worms. So you see this in third world countries for the most part. It can happen here. But people with elephantitis, where they get the huge legs and they're trying to do it, the worms get in there, they get up to the lymph node, they clog up the system, and the fluid just builds up behind it. And so not common here, but when we were kids and we were in biology, probably all of us would look at the pictures of the people that were carrying around either a limb in a wheelbarrow or the testicles in a wheelbarrow and that kind of stuff. That maybe I did it, maybe you didn't, I don't know. But anyway, that's the roundworms in there, the nematodes. I still see, I thought, I don't want to go to Africa. Lymphoma, the most common two lymphomas. So lymphomas are cancers of the lymphatic system. The two common ones are Hodgkin's and non-Hodgkin's lymphoma. This is when you actually have a cancer against the lymphatic system. Everybody says, well, I know a cancer that moved through the lymphatic system. It moved through it. It was picked up maybe at one area, it moved through and it went to another area. That's different than having a cancer of the lymphatic system. That cancer can be in the lymphatic system, in the lymph nodes, that kind of stuff. This is actually a cancer of the lymphatic system. There's a difference there. Metastasis via the lymphatic system. So again, you get prostate cancer, you get colon cancer, lung cancer. Your body tries to clean it up, get rid of it. It pulls it into the lymphatic system. It goes up to a lymph node, and basically the lymph node says, I don't know what to do with it. White blood cell pulls it out, starts moving around, and that's how metastasis via the lymphatic system happens. A lot of times they will catch cancers inside the lymphatic system because it's trying to clean it up. They'll go in, they'll take out a lymph node. A lot of times with breast cancer, you'll see them do this. They take out lymph nodes and they test them. They basically take them out. They put them in a wax is what they do. You slice them paper thin, even actually thinner than that, thinner than paper thin. You put it out on a microscope and you can start to stage it. You say, yeah, this has infiltrated the cell. This many cells are done. This is how far along it is. And so they use lymph nodes a lot of times for staging cancers. It's a good place to gather up the bad guys. They've been sequestered there and you can find them. Lymphatic system and type 2 diabetes. So I went back and forth on this information and what to change it to and what to do with it. I hit a lot on fat metabolism and using the lymphatics and lacteals to move fat around. But also, when you're moving fat around, a lot of times insulin is involved with fat. Insulin triggers fat cells to take in more fat. So insulin moves throughout the lymphatic system quite a bit to help you take fat in and out of the fat cells. When the lymphatic system gets gummed up, you have a much, much higher likelihood of having type 2 diabetes and insulin resistance. And so individuals that may start out with a lymphatic problem end up with type 2 diabetes. The opposite happens too. If you have type 2 diabetes, a lot of times you become insulin resistant. The fat doesn't know how to move in and out of the lymphatic system, and you end up with a lymphatic issue. So they go hand in hand, and this is why we start to have problems with swelling in the feet. We have all those problems when we have diabetes, is because the lymphatic system is basically confused or not working properly, and we have a situation there. So they go back and forth of how that works. Lymphatic system and cardiovascular disease. So if I am sending out fluid down to my feet again, and I'm supposed to take in 17 liters back into my cardiovascular system, and now all this fluid is piling up in my legs because my lymphatic system isn't working, I'm going to have a harder time pumping the fluid down there. So my pump has to work a lot harder to pump the fluid down there. Then it's actually trying to pull in more fluid than what it's designed to pull in. My heart's working a lot harder. And so I'm building up higher pressure. I'm having a lot of debris that's not supposed to come back in. It's supposed to stay in the lymphatic system. It's getting squished back in. And so now we start having all kind of cardiovascular disease. Lipids start to build up. One of the most important things for the lymphatic system is to move lipids around. When the lymphatic system can't move lipids around, now your heart just took on another job. It has to move lymphatics around or move lipids around, and those lipids start gumming up. They start sticking in places. Instead of being cleaned up like they're supposed to, they start sticking places. So then we start getting inflammation, and we have the whole atherosclerosis. We have the whole heart disease issue going on. So very important. If anybody was here for the cardiovascular talk, I talked about mitochondria quite extensively in that. So now when we know that lymphatics and mitochondria go hand in hand, mitochondria is what gives our heart all the energy. It's what gives all of our arteries the energy to rebuild and do what they have to. So now we start having a lymphatic issue. Our heart has to work harder. It also can't work harder because now the mitochondria aren't working right, and we start having all kinds of heart problems. So those things go hand in hand. We take care of the mitochondria, we take care of the lymphatics, we have less heart problems. So now, what kind of lifestyle things impact our lymphatic system? Our lymphatic system, I talked about it being sucked up by the heart. So every time our heart beats, it moves it up. The most important thing for your lymphatic system is actually your muscle contraction. So as I walk, as I bend my arms, as I bend my legs, bend my arms, I'm squeezing the lymphatics. So if my hands are out here and I just left them down here by my side, I didn't move them, they would swell up bigger and bigger and bigger and bigger and bigger and bigger. If I take my hands and I start squeezing and move them, I'm squeezing the lymphatic fluid out of them, up the lymphatic system. So my heart beats, sucks on it. Well, it's kind of like if you take that milkshake and it's really thick, if you're trying to suck it up with a straw, sometimes you tilt the glass up so it'll start running up the straw for you. When you're moving, that's what you're doing. You're squishing the fluid, you're making it thinner. Instead of it coagulating in there, being like jelly, you're starting to make it thinner, and you're squeezing it out. So sedentary behaviors, when you're sitting there, you are gonna swell. There is no doubt about it. Go take a flight, go to Europe, go to Florida from here. By the time you get there, you go to get off the plane and you're swollen. It happens. So if you're gonna go sit somewhere for days and days, it happens all the time for people. They'll have a loved one in the hospital. they'll go set by them in the hospital. And a lot of times, all of a sudden, they will start having lymphatic issues in their feet, their legs. They may even become septic. And they'll say, well, I caught that at the hospital. Could have, but actually, you probably set too long. You started getting fluid built up, and it was a bacteria that was already on your skin that you had a problem with. So it happens quite often. Poor diet. We talked a little bit about gluten, but all the preservatives we have in this case in this country, and I think RFK is trying to change it. I don't know if he'll make headway or not, but kind of when COVID happened, they changed policy in the United States of what preservatives and what things they could put in there. It was already heading that direction, but they decided that they would base what kind of preservatives, what kind of chemicals would go in your food based on one dose toxicity. So as long as one dose, and one dose is a serving. So let's take potato chips. As long as 8 potato chips wasn't enough to kill you, they could put whatever they wanted to in that 8 potato chips. Well, nobody eats 8 potato chips. I tell the story quite often. We sold a house one time to a guy who was a bakery engineer, which I would think, hey, you go work on all the things. His job was to formulate the stuff in the bakery. And he couldn't come to closing of the house we were selling, and this was like March. And he says, I can't come. This is our busy time of year. I can't come. I'll just pre-sign for it and everything. I finally says, what are you busy for? He goes, oh, the holiday's coming up. I said, what holiday? He goes, well, 4th of July. We're talking March. And I said, hold on. You're baking right now for 4th of July? He says, yeah, we're baking all the buns, all the hot dog things for 4th of July. I said, how does that work? How the hell are they going to last? He goes, well, we put them out in the tractor trailer truck. And he says, they have enough preservatives in it. It'll probably last for years. And then we fumigate the truck, and they'll set in there from March until about July or June when they go take it out of the store. Well, you can do that because one hot dog bun doesn't have enough poison on it to kill you. So therefore you can do it. So it's called one dose toxicity. So poor diet, processed foods is going to cause a problem with your lymphatic system. Your lymphatic system is going to take in that debris. It's going to be trying to figure out whether it's a good guy or bad guy. And so it's kind of spending a lot of time doing it. Your immune system's fighting, and usually it's going to decide, okay, that's a bad guy too. But probably the gluten's a bad guy, the cornstarch in it's a bad guy. So you start getting all these food sensitivities because of our poor diet. Go back and eat what I had a gentleman the other day, a nice French gentleman. We were talking, and he goes, my family tries to eat only stuff that we would have ate 200 years ago. In very incredibly good shape. They do wonders in their diet. And that's kind of what we need to look at. Toxic exposures. If you've ever been to the other talks, I've talked about me when I was a kid. I'd drive the tractor, and I'd be spraying Roundup behind me, and I'd be eating a bologna sandwich, white bread bologna sandwich with extra mayo and extra Velveeta on it, and I'd be drinking a Mountain Dew, driving with my knees, and I'd turn the tractor around at the end of the field, and the Roundup would spray on me. And I'd always think, that tastes pretty good. It just added to the bologna sandwich. I was exposed to more toxins than you can imagine, so if I make it long, I'm doing something right. Stress. So stress is interesting. Anybody who's ever taken like a Medrol pack or a steroid pack of any kind, you swell up. You put extra fluid on, it just tends to happen. And it's kind of a natural thing. Stress does the same thing. Stress swells you up, especially women. Someday I'll do a talk on primitive man, and there's a big difference in stress between men and women, but women will put on fluid. Well, that fluid's a little thicker when you put it on. That fluid doesn't move in the lymphatic system. So a lot of times you take a Medrol pack or a steroid pack and you gain weight, that's lymphatic weight. And it's lymphatic fluid, so it takes a while to catch up on it. Stress puts the same cortical steroids into you. So you get stress. A guy, though, tends to lose weight when he's stressed. A woman will almost gain it every time. You see both of them, something's going on. They're having a hard time paying their mortgage. They're having a problem with a child, grandchild, something like that. The guy will go shrink in. The lady swells up. It happens that way up until a certain age. About 75, they actually kind of flip-flop. And the guy gains weight at that age, and the lady will lose weight. But anyway, that's due to stress and impaired lymphatic flow. Motion and activity is how you take care of this. That's the number one thing you can do for lymphatics. Move. Move, move, move. Number 2, clean up the diet. Reduce your exposures. Hydration. So lymphatic fluid is mostly water. And if you're not putting water in, so we'll talk about hydration, and somebody goes, oh, I drink plenty. I'm well hydrated. And even sometimes they tell me, yeah, I drink water. And when you get down to it, no, they're drinking green tea, they're drinking Mountain Dew, they're drinking things like that. So Hydration, I should put hydrating with water. Reduce stress. So interesting thing, I've talked about this a couple times in here. If you want to reduce stress, the best way to reduce stress is go for a walk. And when you go for a walk, you don't think about, oh, this is happening with the kids, the grandkids. Oh, I got to do this, I got to do that, I got to do that. You go for a walk and you look at things as if you're looking for something to eat. So primitive man, when he's walking, he's thinking about all the things that's going wrong. He's thinking basically about, I'm thinking about all the tigers that are trying to eat me. And so he's stressed out. The second you go out and you think, well, look at that dandelion. Look at the flowers on that tree. Look at that rabbit. Look at that. Your primitive brain says, oh, we're looking for food, so we're not worried about anything anymore. And so you take away stress. So your mindset when you walk and when you do stuff changes that whole stress thing. In fact, Einstein was probably one of the best at this. When he would get stressed out and do stuff, he would go for a walk, and the way he walked and the processes he had would take all the stress out of his work. He'd come back and solve the problem real quick, and he did it very well. And then those things are what I'll cover them a little bit better here in a minute. Movement and exercise. So I'm going to say I probably should have put walking as number one. Would have been important there. I would say deep breathing, number two. And if we get to it, I have about a 2-minute video to show you on deep breathing. And anybody who's been a patient, and I've probably maybe showed you deep breathing along the way. Some people I have, some people I haven't. If you do it, you can get a lot of lymph flow when you do that. Rebounding. Rebounding is okay if you're getting lymphatic flow. Some people will come in and they say, oh, should I do the rebounder? And they're having lymphatic issues from their waist down, and we put them on a rebounder, and what happens is it's thick fluid and it keeps jiggling down, jiggling down, jiggling down, and next time they come in they're having leg problems. So rebounder depends on the person. If you're in the acute phase and we just need to get stuff moving, rebounding is great. Otherwise, I'd rather see you walk. Yoga is good because you're using muscles, you're squeezing them, you're getting in different positions. Yoga is good. And actually, one of the biggest things for yoga is to get fluid moving. Yes, sir?
I don't understand what you mean by rebound.
Rebounding, yeah, perfect. So there's little trampolines you get on, and they're rebounders, and you bounce up and down on them. Some people will do it just jumping up and down. You're probably much better off walking up some stairs or walking around the room. I used to have a neighbor, Rudolph was his name. He was 98 years old, had lymphatic issues, and he lived in a house that was a circle. He'd start out in the dining room. He'd walk to the living room, he'd walk to the bedroom, walk to the kitchen, walk to the dining room, and he walked around there, and he'd walk all day long, and he wouldn't have any lymphatic issues. He says, if I sat down all day, I swell up pretty big. And so motion is important. That rebounder is good for some people, but not others. Hydration, we covered that. If you don't hydrate, this gets thicker. So anybody, and this is probably where the medical world messes up quite often. Somebody comes in, they're not necessarily having blood pressure problems, their heart's beating fine, their heart's beating normal, and they see lymphatic issues in the legs, and the very first thing they're going to do is put them on a diuretic. And that diuretic makes you pee out the water. Usually, you won't see the lymphatics go down. Now, once in a while, it'll be the reverse. You put them on a diuretic, you'll see the first part of the shift, they'll lose water weight real quick, but then that gets thicker. It actually makes it like jelly in there. So you'd be better off having a lymphatic pump that individual to start squeezing it a little bit lightly, not hard enough to break the vessels, getting some massage, doing compression socks. But when your first thing is to go to a diuretic, we have a problem. Now, I just said that. I said without heart problems. That's a significant difference there. If you come in and you have congestive heart failure, your heart's not beating hard enough, you have to get the fluid off. You have to go to a diuretic. The problem is a lot of doctors don't make that distinction between heart problems and lymphatic problems. So if you have a heart problem, you're going to have a lymphatic problem and you need the diuretic. But if you don't have a heart problem and you have the lymphatic problems, don't go for a diuretic right off the bat. It's not the way to do it. Stay hydrated.
What's wrong with green tea?
Green tea is a diuretic. In general, green tea, most people are drinking green tea and they will lose more fluid out than what they put in. So in a day's time, if you go and drink a gallon of green tea, you're typically going to lose out 1.25 gallons of fluid. So it's basically a diuretic. So it's kind of interesting. There's a lot of good properties in green tea, but you probably need to do green tea and water, so that you're balancing out that equally. Yeah.
Same thing with coffee.
Coffee's even worse. So if you get an individual that comes in and drinks coffee only, they will always be dehydrated. If you drink more coffee than you drink water, you will be dehydrated. So, and I have a lot of people, do you drink water? Yes, I drink water. Yes, I drink water. And they come to find out, I'm like looking at them, I'm examining, I'm like, you are dehydrated. I don't know how on earth you're saying that you're drinking water. Well, yeah, I have 2 pots of coffee a day. Yeah, so you're losing 3 pots of water a day, and it's a real thing. And plus, you're causing those cortical steroids to go up, which then you're thickening your lymph even more. So you need water. Water is important. Diet for lymphatic health. Eat an anti-inflammatory diet. So vegetables, fruits, avoid processed foods. I would say, I probably should have put on here, avoid American cheese at least, or avoid cheese, because they're going to thicken it. A great example of dairy causing thickening, if you go and you spit, it comes out real nice and easy. Go and eat a piece of cheese. Wait about 10 minutes, and if you go to spit, it'll string out to the floor and you can suck it back up. It's because it thickens that fluid. It does the same thing. I should demonstrate that someday when I'm giving a talk. Poor Ashley, our case manager, I tell people that when I'm doing over the report findings, sometimes I say, yeah, this is what's going on. You have lymphatic issues. You need to get rid of the dairy, and I say that. And she can't handle anything spit. She doesn't like it all. And she will almost turn green on me when I do it. Sometimes I do it just for fun. So avoiding the processed foods, dairy being a big one in that case, and then food sensitivities. If you have a food sensitivity, all that is getting pulled out in the lymphatic system. Your lymphatic system is reacting to it. It's clogging up the system. You're going to have problems between thyroid, swelling, gut issues, and that kind of thing. Yes, ma'am.
So what about almond milk and soy milk and
Yeah. So
every other?
yeah, it kind of depends on what's going on. I use some. I didn't take and remove my milk and put almond milk in those and go crazy on them. Because if you do, you're going to end up having a problem. Your body's going to think you're being attacked by almonds. You're going to be attacked by oats. You're going to be attacked by that. So you don't make a one-to-one replacement. You say, yeah, I'm going to put it in here when I need something like that. But it's not like, say, hey, I'm drinking a gallon of milk a week. I'm just going to drink a gallon of almond milk. You don't make that change. You go back and say, I'm going to put in vegetables. I'm going to put in fruits. I'm going to put in proteins. I'm going to put in healthy fats. And you go that way, you know.
So you hear a lot of good things about Greek yogurt.
Yeah.
That's a dairy.
Yeah. And so it depends on the individual. You know, if Greek yogurt, you're having a little bit here and there, it's good for you. But actually the things you hear about Greek yogurt are done by the Greek yogurt company. I used to own a supplement company. And one of the things that all the supplement companies do is they hire doctors to write white pages. And a white page says, you go out and you find any study that says this is a good item. And basically you write a paper that says how good it is. And in fact, it is most of the supplements that you're seeing online on Facebook and things, they have really good doctors writing really good white pages. And I'll say the best one out there right now is methylene blue. Methylene blue is actually toxic to most people at a rather big dose. So even if you're taking a drop a week, that's it. And you'll take it to begin with, you feel really good. And then all of a sudden after that first week or so, you're like, yeah, I'm tired. I don't feel good. It's because you're basically you're toxic now. So yeah, yogurt, and who has the most money out there to write white pages? You know, the beef industry, the dairy industry, McDonald's, you know, those kind of places do it. In moderation, there's some good things to it. You have a probiotic in there. You have 1 trillion different bacteria in your gut. In what world would it say putting in acidophilus every day in high numbers would be good when you're trying to grow a good garden? You know, but if you're trying to grow, let's say a flower bed, and you want this really nice spring mix, you want to have all these different kind of flowers in there, and every day you came out and you threw out marigold seeds. Every day you threw marigold seeds on that garden. After a year or so, you're going to have one thing in that garden. You're going to have marigolds. So that's why some yogurts are a bad deal, because you're actually putting in acidophilus at this huge amount. And then all of a sudden, 3 years later, your gut, you're having problems because you overseeded it. So it's a sales play. You need to change it up. Probably not as good as actually going and eating plant-based fibers that the good bacteria grow on in actuality. Massage. I've hit on this. Manual lymphatic massage. A manual lymphatic massage should not be a torture session by any stretch of the imagination. A good lymphatic massage should be extremely light, and you should almost feel, you need a bottle of water? Okay. A lymphatic massage should be so gentle that you walk out and you think, I'm not so sure they did anything, in all honesty. If they're going to do some deep lymphatic vessels, first of all, they ought to know where the lymphatic vessels are. And second of all, they ought to come in so slow that they're coming into it, they're talking to you, and you don't even feel how far they're getting into the tissue. They're in there, they come along real slow, and they push it out. It's not a deep tissue massage. In fact, deep tissue massages can damage the lymphatic vessels because it's like a sponge in there. You can rip it. You can come in and you can break those valves in there. So a good massage, anytime, even a deep tissue massage, they don't come in and they don't force their way into that muscle. It should be come into the muscle, set up on it, keep pushing in there. And some of you have been in here to see me and I felt your muscles, some of you are tight in the shoulders. And usually you don't have me come in and digging into you. I'm not digging into you to break you up. I come in, I put my fingers on you, I usually move it slow. Some people that have been to see me for first rib problems, for thoracic outlet problems, I don't come in and I don't go, I come in, I usually massage your shoulders a little bit, loosen up, come in real soft, and I move it. And you get up and you're like, did you do anything? You get up, oh yeah, you did something. That's how you do a lymphatic drainage massage. This is probably going to tell you more about how a lymphatic massage should be done. So lymph tissue, when you do dry brush, and I should have put a picture of it. Dry brush looks like a horsehair brush, and you can have just a little pad or you can have a handle on it. Basically, you take that and you take the brush and you start down at your feet and you just brush it. And it's not much harder than that. I'm not taking and pushing in like this here. I'm going across the top. When you do a lymphatic massage or brushing, the whole idea is that you're getting fluid to move. And you get what's called laminar flow with lymphatic massage. When I take very lightly and I'm brushing this and I'm brushing it, basically the fluid under the skin moves just real slowly. And as it starts to move, it actually makes a vacuum or a suction behind it, and it starts sucking up the next thing, and it starts moving. And you, very lightly, just doing a lymphatic massage, later on you can see a difference. I've had individuals that I've done lymphatic massage, and then I will do like acupuncture or something for them, and I come back in and they get up and they're like, I don't know if my hands have ever been that small, or they go to put on their shoes and their shoes are loose. And that's because dry brushing, lymphatic drainage massage shouldn't be a torture session. It should actually be almost as if you don't feel it.
The dry brushing is always towards the
Always towards the heart. So when you do dry brushing, especially like legs and arms stuff, you start down at the bottom, you brush up, and you go all the way around with it. And then you do it like 3 times all the way around. And then you come to your knees, you bring it up through there, do it all the way around, and then you can come up and even just do the belly, and then you come up to your arms and you bring your arms in. It should be 5 minutes. It shouldn't be an all-day ordeal. You do it a couple times and it makes a big difference. So people do it a lot of times before they go to bed. They'll do it when they sit down in the evening time. Makes a big difference there. Yes, ma'am.
lymphatic actually like flow and run away if the valves are broken?
Yes. So that's by that rebounding. That's kind of what I was remembering. That's a backwash. So people that get on a rebounder, if their fluid's too thick and their valves are broken, people say, well, why don't you just go do rebounding? It worked really well for me. Well, their system's broken. So they get on the rebounder, they start bouncing up and down, and next thing you know, their ankles are twice as big that night, and they'll say, I don't know, or they'll do something like, they'll go out for a run, because like, I was told I need to exercise. So instead of doing a nice walk, they go out and they run real hard while everything's getting pushed to the floor, and all of a sudden they come in like, my fingers are like sausages, my legs are like sausages. We need to work on some lymphatic things. You're probably better off doing chair yoga to get the fluid moving instead of that rough of a stuff. So yeah, it can backflow basically. Saunas, I don't like heat, but saunas that are warm, infrared saunas, red light therapy is incredibly good for helping this out. It tends to move debris out of the way. It tends to help you recycle fluid. And so saunas and red light therapy are incredibly good for this.
What's your take on foam rollers?
Foam rollers are good as long as they're not used too hard too. So foam rollers are made to move fluid. They're made to stretch scar tissue, to break up scar tissue. Some individuals that have myofibralgia, they have fibroids and stuff. They have basically where their bodies try to get rid of chemicals. When your liver can no longer get rid of a chemical, it pushes it out to the skin. and it tends to get caught in that layer underneath the skin. So if you skin an animal, and humans included, a lot of times what it looks like underneath the skin is looks like that you have spider webs around you. That's the fibrous layer around there, fascial material. Debris tends to get pushed out and gets stuck in there. And in some people, it gets stuck there and they get myofibrology issues. They hurt all over. Other individuals get psoriasis. It gets pushed out a little farther and it starts trying to come through the skin. That's a situation where when you foam roll, if you do it lightly, you can kind of break it up out of the fibers. If you get in there and just go to town on that foam roller, you actually irritate it. So now your immune system comes to that area. It sees the bad guy and it thinks your tissues are the bad guy too. And so now you start having really bad problems. So a light foam roller is it. There's a difference between foam rolling for the myofascial layer and foam rolling a muscle. So if you have a calf issue that's cramped up and you want to come in and do light foam rolling on our hamstring, that's different than fascial material. So if you're going to do fascial material, you need to be very careful with it. Breathing. I'm going to have a video here in just a minute on breathing techniques that will show you how to do correct breathing on this. Compression and elevation. So in that lymphedema therapy clinic that I went to, the main thing they did, they would measure for compression fittings. Compression basically squishes it. Some people that have come in to see me and they're swollen, from the waist down, they've had a hysterectomy. They come in and they cut out everything. Well, they cut the chain between the lymphatic flow from the legs up to here. A lot of people that have had multiple abdominal surgeries will have that cut. And so you'll see people that all of a sudden are really heavy from the diaphragm down. And you'll see them. They come in, they're almost a parachute. Wham! Sometimes it's hormonal. That's what most of the world will tell you. But most of the time, it's a lymphatic issue. You ask them, have you had abdominal surgery? Well, yeah, I had 6 of them. I had my hiatal hernia fixed. I had a hysterectomy. I had a pelvic floor surgery. I had my appendix removed. And those individuals have a very hard time because all the lymphatic fluid from here down has been severed. So their catch is you got to get a way to get the fluid from your legs up to here. And that deep breathing does it. Compression is the same way. If you take somebody and you put them in a full leg compression and they're really swollen, the fluid can't get out. So a lot of times we'll want people to say, hey, let's do compression. Let's get you a knee high. You'll come into a knee high compression, their feet will start going down, legs will start going, but a lot of times they'll actually even gain fluid here in their thighs. But at least we squish it out down low. Then we come in and now we'll do a compression a little higher, so we're slowly getting it out. If you just come all the way up here to begin with, you have a hard time getting it. It may work, but it's that way. They also have new compression pumps nowadays. And they basically come in and they squish it lightly and let off. And none of those I've seen people that have them, like, I turn it all the way up. Well, it's the same thing with going and getting a lymphatic massage. You could be breaking materials and everything, especially starting out. You want it to be very mild. Compress it, let it go, compress it, let it go. And that's a real thing there. Elevating. So moves fluid around. Well, if I'm trying to get fluid from my legs here, again, I'm doing the milkshake. I'm trying to suck it up with a straw. It doesn't go very good. Sometimes I pull out the straw, turn up the glass because it's going to come downhill. Same thing with this, elevating. If your feet are swollen, you have problems like that, elevating it makes a difference. If your arm's swollen, sleeping at night, putting it up on a pillow, it'll come down. Makes a big difference there. Let's see. Avoiding the toxins. I mentioned again, I'm kind of going over it again, but it's important. Avoid the environmental toxins, the processed foods, artificial additives. We have more than we've ever had. Probably our biggest issue in the United States. Go to Europe. You don't see people swollen. Most people say you don't see fat Europeans. The truth is you don't see swollen Europeans. We're swollen. Even our healthiest people now, go back in the 70s, look at the beach pictures, look at the beach pictures now, and we'd say, okay, those are fat people. There are some fat people. Most of us are swollen. It's a real thing. Exposure to heavy metals. The reason heavy metals are a big deal, mitochondria, which are your little powerhouses, they take care of reactive oxidative stress. Well, that means rust. Reactive oxidative stress means rust. When you start throwing heavy metals in, they get into that mitochondria. They start having problems taking care of the rust and getting it out of the system. When you have a mitochondrial issue, you're going to have a lymphatic issue, you're going to have a heart issue, you're going to have diabetes. So heavy metals are a problem. They're seeding our clouds with aluminum all over the world to try to get us to have rain in places. Dubai does it every single day. Our jet fuel, they've added aluminum to our jet fuel, which they're trying to get cut out now. They're actually working hard to do it. You get better gas mileage when you have aluminum in jet fuel. So to make better gas mileage, they add aluminum to it. Even our automotive fuels, they're adding aluminum to it so we can get better gas mileage on it. So
Is that why there's more jet fuels?
that's probably one of the bigger issues. So aluminum sulfate makes moisture stick to it. So as a jet's flying along, if there's more aluminum in the fuel, as it comes out the back, you see the moisture sticking to it. So they're not necessarily more jet trails. You see them now because of the aluminum in it. Endocrine disruptions. So a lot of times now, our meat, they have chemicals in it, like they're actually not hormones, because China stopped letting us ship meat there because we had hormones in it. So they're using peptides, like Paline and things like that, which plug into the receptor site, telling the cow's body or pig's body that they have a hormone in there, so they get fatter. So it's not officially a hormone anymore, it's a peptide. Those peptides disrupt our endocrine system. Different food sensitivities disrupt our system there. So we need to reduce those toxins to reduce our inflammation to help our lymphatic system better. Medical treatments. So I should have said right off the bat, and I missed it in this slide, it should say diuretics. That is the number one go-to in the medical world. You have swollen feet, let's put you on a diuretic. Don't even care what your heart's doing, let's put you on a diuretic. Probably a mistake. If you have a heart problem, it is the right thing to do. Without a heart problem, not the right thing to do. Your lymphatic massage is number one, and by somebody who does it right. And not everybody who does lymphatic, I would say probably every massage therapist in town would say, I do lymphatic massage. I don't think they would not say they didn't. But if you ever had a true lymphatic massage, you'd realize you walked out and you would almost say, boy, they petted me, is what you'd say.
Very gentle.
It's very gentle. There's not a lymphatic massage that's hard. You'd be petted, basically. But you'd notice when you came out that basically your hands were smaller, your feet were smaller, your legs were smaller, and pretty well you're going to have to go pee. You're going to notice it. If you get down with them, and sometimes they have to pee in the middle of the massage if you're having big lymphatic issues. Compression. Compressing works out. That's why also too, I'll tell a lot of ladies who don't have compression stockings and things, but they go take a flight and they have a lymphatic issue. I say, put yourself on a nice pair of socks and go get yourself a pair of yoga pants that are compression yoga pants and wear those on your flight. It lowers your chance of having lymphatic problems, swelling up while you're flying. It also lowers your chance of having blood clots. The blood clots that you get a lot of times when you fly, it's because the blood goes down, but it's also contributed to by lymphatic issues. So it's both of them together. That's why the compression stuff helps the blood flow better, also helps the lymphatics out when you're flying. Exercise. So again, when you squish a muscle, it squeezes out the lymphatics. And so exercise makes a big difference. Yoga is a great one. And there's a lot of people that say, I can't do yoga or I don't have time to do yoga. Go online sometime and look up chair yoga, geriatric chair yoga. There's nobody sitting in an office, nobody sitting anywhere that can't do some of those things while you're sitting off. So, it may just be bringing up your legs while you're sitting there. It may be shifting your weight in the seat. Anything that compresses muscles is going to work out there. The medical world may use antibiotics, and there's times you have an infection in there. You need an antibiotic. Surgery. So there are times where you have a blockage. There's an area right here in your groin called the inguinal ligament. It basically has a hole on both sides there that your blood vessels come through, your nerves go through, your lymphatic goes through. Some individuals have a smaller inguinal ligament hole in it, and so they got to go in and open that up. Sometimes we mentioned putting them closer together. So if they come in and they operate on your knee and they cut the lymphatic tissue, sometimes they have to come in and put it closer together. Sometimes they have to do that with breast tissue too. Sometimes it's the fact that they have to go in and put a stent in. So some individuals will have problems with their lymphatic system where they're not getting the cerebral spinal fluid to clean out. They'll come in and drill a hole in the brain, put a little stent in it, and they run it down basically into the gut or into the heart to bring that fluid back into the circulation. So there's different surgeries they can do. They're not common. Most doctors overlook the lymphatic system. And then radiation for cancers, removing cancers with surgery, that kind of thing. Those are the general medical treatments, but you don't really see anything about changing diet in here. You don't see anything about thinning lymph out. You don't see anything about hydrating. That's typical. And it's not a doctor's fault. It's just not, it's not taught. There's not a medication there. There's not a good surgery. So they usually hand you off. If you go to a good physical therapist, they're probably better off in that than any medical doctor would be. The protocol, I told you I was working on a protocol to help out with these things. It's going to be called the Restore. Each letter means something, but daily movement is important. If you're going to sit still, you have a problem. If you're sitting in an office job all the time, park your car in the back of the parking lot. Take that extra walk. Get up and move. Stand up and eat your meal while you're eating lunch or whatever. Just get some motion into you. Tap your feet. Hydration, water. So the gold standard, and that changes all the time, but the gold standard in hydration is typically half your body weight in ounces of water up to 100 ounces. That's kind of the gold standard. If you're going to go run, you're going to go lose a lot of things, it's hot out there and you're walking everywhere, you're going to need more fluids. You're also going to need more electrolytes. Clean eating. If you eat meat, vegetables, fruit, and complex carbs, that's things that are like brown rice, quinoa, sweet potatoes, oatmeal, as long as you're not sensitive to them, beans. Those are good complex carbs. That's clean eating. That's how you eat. I didn't mention bonbons. I didn't mention ice cream. I didn't mention anything that had flour in it. I didn't mention anything that had, Cheetos would be a perfect example of not what to do. I used to have them on my bologna sandwich when I was driving the tractor. Deep breathing. The next thing is a video on that. Herbal tonics. So we use a product out here by Physica Energetics. It is, Dr. Cass is one of the best homeopathists in the world and herbalists in the world. And he has a product called Lymph 2 Matrix. It does a good job of thinning out lymphatic fluid. And it's, as far as I've seen in my entire career, there's never been a side effect from it. But I can take people that have real thick fluid. You go to feel their ankles, they feel swollen up and everything. You give them Lymph 2 Matrix and it thins it out. Desbio makes some. Most of your homeopathic companies make a lymph drainage product. And the best I've ever seen in the world is done by Dr. Cass through Physica Energetics. And so anybody that comes in that has a lymphatic problem, they pretty well get Lymph 2 Matrix. And they'll say, how long do I stay on it? And I'll say, when the lymph is no longer an issue. Sometimes it's 1 or 2 bottles. Sometimes they're on it the rest of their life. It kind of depends on what's going on and whether they clean up their diet. Some people come in, they don't clean up their diet. Some people have food sensitivities that they still get little exposures. Lymph 2 Matrix is the best out there. Regular massage helps out. I had a massage today. I walked out there and I thought I was drunk. I hadn't had a massage for 3 or 4 months, and I guess just pushing the toxins out and everything, I thought, wow, I'm not sure I'm going to be able to function tonight. So hopefully I've done okay since then. And I tell every massage therapist I see, don't come digging in there. Don't come hard. Come in soft. And I'm pretty quick to tell them, hey, let me show you. Give me your arm for a second. Here's what you're doing. I said, here's what I want. Just come in. My body will let you in if you just take your time. And most everybody's receptive to that. And then saunas, sessions. I didn't put red light therapy. We have a red light therapy bed at home. Red light therapy is good because what it does is it cleans out the mitochondria. Then the mitochondria can function better, and then basically it can clean out fluid. So that's why the red light therapy is really good. This is a video. Let's see if it plays. Hello, Dr. Thoma here. That's a good guy. We'll have to hear what he says. Hello, Dr. Thoma here, and I want to show you a deep breathing exercise that helps take you from sympathetics or fight or flight to parasympathetics, rest and digest, helps you sleep better, helps you heal better, but mainly helps you move lymphatic fluid from the lower body to the upper body so that you can be healthy and happy. When you're laying in bed or laying on a couch, you simply take in a normal breath, and when you let it out, you want to let your stomach retract in, but when you begin to take the air back in, you let your stomach relax, holding your chest a little tight so the air goes down, pushes your lungs down to the lower half of your body. So it's as you breathe in. Like this. Your chest does not move at all, just your abdominal relaxes, letting your lungs expand downward. When you can do this, then you want to actually expand your lungs to the point that you actually move the pelvic floor or fill air into the crotch area. So it's like this. When you release the air, you open your mouth and just let it come out fully. Take another breath in, expanding into the abdominal area, expanding into the crotch. Continue taking air in to expand the chest. The last part of this is to expand in the apex of the lungs, the top of the lungs. So we're going to take a deep breath in, expanding the abdominal area, expanding the crotch. Without transferring the air from your abdominal area to your chest, you want to keep taking air in and let the chest expand. Then we want to expand the apex of the lungs, the top of the lungs, which will feel like your throat. And then release it. We're going to do 5 breaths that way. Expanding the belly, expanding the pelvis, expanding the chest, expanding the apex of the lungs. If you feel like maybe you're suffocating or having difficulty with it, just know that you're getting plenty of oxygen in, and if you just keep taking the air in, it will fill all these spaces. And to begin with, you may not be able to do it fully, but with practice, you'll be able to fully extend the abdominal area, the crotch, the chest, and the apex. And if you do this, it'll allow you to have better lymphatic flow, it'll help you relax, and it'll help you sleep better at night. Yeah, and so it's harder to do standing up, but you can. So you just take in air, you fill up then down lower, and basically I'm just letting my lungs push down. Then you take it into your chest, you keep taking it in, then you take it up here in the top of your lung. So you basically go, and now you're all the way full, and then you just open your mouth and let out. But what the purpose of this is, as I took in air, my lungs expanded down in this area. 60% of my lymph nodes are around my gut. So I squished that fluid. So I'm kind of doing a compression sock on it. Well then, whenever I get it all the way full and I'm all the way full up, and if I let it out rather rapidly, so you open your mouth and just let it out. A lot of people try to control, no, let it out. When that happens, it makes a negative pressure on that lymphatic system, so it sucks it back up. And even if you have a cut or anything in there, it'll pull it up where you're getting the fluid up here higher. And if you learn how to do that, especially in the evening time for bedtime, or when we first wake up in the morning time, you will move more lymphatic fluid doing that one exercise. And literally, it's 1 to 2 minutes is all it takes. It takes practice to do it. It's not easy. Most people will come in and they'll go, and they're using their chest. Well, I'm actually not doing anything when I do that. If you come in and you learn to fill the belly up first, then you learn to fill up down low into the crotch. So I'm really pushing my lungs down to here. Then I take and fill up my lungs more. Now my lungs are down to here and they're full. Then the top of the lungs is still squished. I got to fill it up. Now I'm all the way full, and then you just let it out. And then it goes, sucks it up. Takes practice.
How many times?
5. 5, usually 2 to 3 times a day. And the other bonus to this is, your body has the autonomic nervous system that controls fight or flight, or rest and digest. So the sympathetics are fight or flight, run from the tiger. Parasympathetics are rest and digest. Your sympathetic nervous system, basically in your spine, is from about your diaphragm up. So when people are walking along going, that's a nervous person, and always going to be a nervous person. The person that's standing there talking to you and they're breathing in their belly, that's a really calm person. And I always tell guys, I say, if you ever get in a fight with somebody and they're breathing into their belly, you're probably in trouble because they've already outthought you. They're going to be calm and collected. So as you're freaking out, they've already laid you out on the floor. So it's actually a real thing. I will say this, even as late, if you're having an argument with somebody and they're breathing up top, they're irrational. You might as well walk away because they're that way. If they're breathing in their belly and they're trying to tell you something, they probably already thought it out. So sympathetics are up top, parasympathetics are down in the pelvis. When you breathe down in the pelvis, you flex that part of your body. When you flex it, it turns on rest, digest, and heal. So if you're laying in bed and you're thinking, I can't get sleep, I can't get sleep, I don't know why I can't get sleep, you're not going to go to sleep. If you lay there for a little bit and you're saying, hey, I can't sleep, let's take some big, deep belly breaths, and especially where you can push it down where your crotch moves a little bit, you can feel your pelvis flex. 5 deep breaths, and you're like, yeah, I think I'm going to go sleep now, and you're gone. So that's an important key. Takeaways: healthy lymphatic support, supports your immunity, reduces swelling, improves detoxification, Prevention beats treatment. So anytime you can keep from having a lymphatic problem, it's much easier than trying to treat the lymphatic problem. Conclusion, support your silent protector. That's what it's really doing. It's cleaning out. It's trying to protect you. It's trying to set up your immune system. Basically through lifestyle habits, that's your biggest thing to do. If you like tonight, I know some of you left me good reviews last time. I appreciate it. I take this from the cattle company when I go and see the Triple C Cowboys. If you liked it, go tell everybody. If you didn't like it, keep your mouth shut. But if you liked it, go on Google and leave me a good review. I spend a lot of time putting these together, about 100 hours probably putting them together. And to do that every month, to throw in hours putting this together is a big deal. So even if you left a review for us, say, hey, I liked his lymphatic review, it was great. If I can do anything in my practice to help you, I do functional medicine. So a lot of individuals say, well, you're a chiropractor. I have 4 degrees, though. When you come in to see me, I'm looking at everything. I'm looking at, hey, how's your nutrition going? What's going on with your immune system? What's going on with your lymphatics? We do a good exam here. We do medical review. So whatever you bring me, medical-wise, I review every stick of it. So some people bring me in stacks. Some people bring me in folders. It goes over. We do a lot of testing here to figure out what's going on. And then we make your plan. It's not a cookie cutter. When you come in to see me, you get my undivided attention and you get what's made for you. So if I can do anything for you, let me know. My job is to educate you so that you can live longer and healthier. That's the whole plan of it. I don't want you being 95 laying in a nursing home, not knowing who you are or anything. I want you kicking and running and doing everything up to the day you say, you know, I'm tired. I'm going to go to sleep and not wake up. That's the way to do it. So any questions before we get you out of here?